So I'm a medically complex patient myself, and I get frustrated because providers tend to look at individual body parts or individual symptoms instead of looking at the patient as a whole person with a bunch of complex systems that are interacting together. For example, if you have tinnitus, ringing, or sounds in the ears, that is often a symptom of there being some type of auditory dysfunction. But for patients for whom the tinnitus is bothersome, it's not just the auditory dysfunction that is occurring. There's oftentimes some sort of cerebral, neurological, or nervous system involvement. There's something that has triggered the nervous system to get into fight or flight that is saying that the tinnitus sound is a threat. These patients are typically under a huge amount of stress. A lot of them have sleep disorders or underlying sleep issues that need to be dealt with, and amazing personalities. They are the type A go-getter, gonna ruminate, fixate, think about, hyper-focus on a problem until they can solve it. And unfortunately with tinnitus, the more we think about it, the worse it sometimes becomes. And when we're stressed out or worried about something, that mental distress can oftentimes lead to a physiological stress in the body, such as increase in body temperature, increase in blood pressure, increase in heart rate, and those physiological changes will drive and make the tinnitus even louder. And so we really have to look at how the ears are connected to the rest of the body. We've got to look at medications. We've got to look at how food allergies or food sensitivities might be coming into play, or what other environmental factors might be contributing. We've got to coordinate with ENTs and pulmonologists and sleep specialists to ensure that people are getting the right amount of rest and the right amount of oxygen flow, because if those are affected, then those are going to, again, keep the nervous system in a state of heightened awareness. And of course, we need to address the underlying auditory dysfunction as well, whether that is through hearing aids, whether they're prescription hearing aids or over-the-counter hearing aids, or using masking sounds, or using a device like Linear. And then we have to address the physical and mental stress and look at relaxation exercises, mindfulness, deep breathing, things that can help your body physically relax, physically calm down, reset the nervous system, and allow people to get good quality deep sleep. So there's just a lot of factors, and it's frustrating in how specialized medicine has gotten, and how we're just looking at one piece or one body part, when collectively we really need to be looking at the whole and how all of these things can be contributing towards making tinnitus bothersome for a person. And the right way to practice is to take all of those variables into consideration. But that takes time, it takes energy, it takes effort, and a lot of providers don't have the luxury of spending that much time with the patient. And that's one of the things that I feel really makes our clinic different in how we approach our patients and how we approach a problem like tinnitus. And we really do our best to try to eat the elephant one bite at a time. So if you have any questions about hearing, tinnitus, vertigo, auditory processing disorder, any ear-related questions at all, please don't hesitate to drop your questions in the comments, and I will try to make a video about it. Thanks so much for being here. I'm Dr. Laura. I'm a hard of hearing audiologist and doctor of audiology. I'm a bilateral hearing aid user myself, and I am here to help you understand and make good decisions when it comes to your hearing and balance healthcare.